hello, and welcome to another episode of Try Talk.
I stopped.
Nobody's excited to be here.
We're waiting for the rest.
We're all here. We're sitting on the couch,
Just chilling.
Yeah. We're joined here by a couple of new faces, a couple of old faces. Not old faces, but the faces you like to see. So today we are all gonna go around and introduce ourselves. Who would like to go first?
Hello, I'm Courtney.
Hey, Courtney.
I'm Layla.
Hey,
Ladies first.
Hey, I'm
Bridget.
you guys.
Ladies. Hey, I'm Brandon. Oh, hey, I'm Eddie.
Why is your voice like that? What do you make your voice like that?
You know how girls have fake names? Mm-hmm. Guys have fake voices.
Mm-hmm. Please.
Oh my god. Okay.
Alright, so I'm going to turn over the mic
That was so
to my co-host
Thank
today.
you.
And she's going to let you know what our question is for today.
Okay. So today's topic or something we want to talk about is actually very, very serious. It's depression. Okay. So this happens to a lot of us. It happens to people that we know, and we might not even know that they're going through depression. Mm-hmm. So the question to you guys is, if somebody comes to you and says, I think I'm depressed or I'm going through depression, what comes to mind? Or if someone just says, if you hear the word depression, what is the first thing that comes to mind? What do you think?
Okay, who would like to go first? Not all at once.
Now, just hold on, guys. Mind you, there is different types of depression.
Yes.
So we're not trying to give an explanation of what depression is.
Yes.
There's like clinical terms and all that stuff. It's just what comes to mind, like
Our
you personally. Like
opinions.
what do you think it is?
Yes. What do you personally? What's your opinion?
Yeah.
Courtney.
I'll kick it off. When someone tells me that they're depressed, the things that come to mind for me is someone who doesn't have energy. They don't want to do anything. They're very emotional, like they're sad. And they just, like I said, they don't have the energy to do anything. They don't want to go out. They don't even want to take a shower. They just want to lay around. That's what I think of.
Man, it's getting sad.
No, we're not gonna let it get sad. This
Yeah,
is,
don't.
No, it is a serious
It
topic.
is a serious topic. It's sad too, because
Yeah.
when you know people who, or like let's say if you've known people who have gone through certain things, or sometimes you won't be able to tell.
Yeah.
Because most often, people who are depressed might have a good way of hiding it.
Yes,
Yeah.
that's true.
They have a good way of hiding. They might be the happiest person, but you don't know what they're dealing with behind closed doors. So it can get sad, but we'll kind of shed some light on it. We'll come back later and give more clinical side of things. But for now,
Yes.
cheer
And
up.
since Mental Health Awareness Month just passed, why not?
Let's talk about it.
I think I can talk more about mental health because if there's certain situations that there's certain situations that you go through. If you're not someone who's certified enough to be able to diagnose what depression is, you go through certain times in life, and if you sit there and you look back at those times, you think, man, I was really depressed at that time. Personally, that's how I feel. Some things, for example, there was a brief period where I was jobless, and it was a short period, and at the time that's one of those moments where you have your whole life in front of you, and suddenly it's like you get the rug pulled from under your feet, and you have to try and figure out, okay, I'm not working anymore, I'm not going to school anymore, I'm just sitting down. And it was hard to sit down at the time and just do nothing. But then after a while, once I got back on my feet, once I started doing stuff, that's when I sat back and I sat down and looked back, and I was like, man, if probably I would have seen some doctor, clinician, or someone who's more qualified, like some type of therapist, they would have probably thought I was depressed, because I can remember at the time, everything just doesn't feel right. Now, whether that was depression or not, I don't know. Or what I can say is that from a mental health perspective,
You felt depressed.
It was, yes, it was mentally challenging. To what point was it challenging to the point where I'd say I was depressed? I don't think I'm qualified enough to say that.
Okay.
Yeah.
Well, thank you for sharing.
And actually, on that note, I think I was talking to Kali the other day, and I was like, sometimes we go through things in life, and then once you pass that point, when you look back, you say, in that moment you feel like you tell we have a habit of like self-diagnosing ourselves, telling ourselves this is what I have, even when it's not what it is. And then later on, once you get past that point, you might look back and be like, you know what, I was just going through a hard time, but during that time it felt like this. Now, before you talk to a professional, we all do it, like we self-diagnose all the time. But before you talk to a professional who has dealt with actually like these actual conditions, there is no telling if you were actually depressed or if you were just going through a rough patch in life.
That's true.
So
Do not self-diagnose.
yeah, do not self-diagnose.
For me?
Yes, sir.
So your question was, what do I think of depression?
So if someone comes to you and says, I think I'm depressed, or if you hear, when you hear about depression, what comes to mind? What's the first thing you think of when someone says they're depressed?
Like Brandon said, I think it comes because of something that happened, or something that happened or is happening in your life. Maybe you lose a job, or you lose a loved one, family member, relationships. It could be anything. You lost your house, or you lost your phone. Okay, let me say you lost your phone and you lost all your pictures and your contacts, your memories are all gone. So depression to me happens because of something that is happening or happened in your life, and maybe you don't know how to deal with it. If you lose your dog, like, what do you do? What's the next step? You've had your dog for like, who knows, 3 years. And then all of a sudden, the dog dies. How do you move on from that situation? You lose your job after working there for 10 years. What do you do? So to me, I feel like depression is caused by something that is going on or happened or went on in your life. Is that correct?
That was outside of your control.
Yeah.
Okay. So do you think? Let me just like jump onto that. Do you think because some people can be depressed not just because of a life event, but because of like hormonal, there's something going on internally. That people can be depressed just like that. Like they'll be growing up and it's like hormone imbalances. They'll be depressed. It doesn't necessarily have to be something going on in life, but that's something else we can delve deeper later on, because there's like different types and different causes of depression. But I think I can see what you're saying is something having to happen, because I feel like most people, something happens in their life and then that's where they'll say, I can remember it was this point in time when things changed.
There's a trigger.
Yeah.
Layla, would you like to share?
So like basically what I think it means. I guess I would say just basically someone that's just like in a stagnant mental frame of mind, in a way, because I can kind of say I was depressed when I first moved to Houston, because I'm from Vegas, and so when I moved to Houston I didn't have no family, and so just being homesick made me feel depressed in a way. So I guess,
Okay. Thank you for sharing.
So, yeah. So shortly, that's like what everyone thinks about, like what they hear when someone says they're depressed. Did I say no?
Not yet.
Would you like to?
Oh, like for me, knowing and having like seen people who are depressed. I can also say I had a point in life where I thought I was depressed, but when looking back at it, guys, talk to somebody. If you feel some certain type of way, find someone, talk to them. Sometimes you might feel depressed, but you might not be because you don't know, you know.
And sometimes
you just need to talk to somebody,
that's
and
true.
then it's like just getting some things off your mind will kind of relieve so many things. So because I had a point in time, this was during college, so many things had happened during that like short period of time, to where I was just like, I didn't want to get out of bed, I didn't want to eat. I would look at just a book of the work that I have to do and I would start crying. So like at one point I thought I was depressed. I was like, man, I think I'm depressed. But I went to the school, they had like these counselors or whatever, and I just sat down with her and I talked and I just said whatever was coming in my head. And since that day, I left and never looked back. Like all those feelings I had before.
It sounds like you went and you just threw everything to the counselor, and then you're like, okay, bye.
Because to me, before, like I would sit in bed, man, and I would feel like no energy to get up, and this went on for weeks. And I was like, something is wrong with me. Like something is wrong with me. But it was all that bottled up, whatever I was dealing with in life, and because all those things were happening at the same time, I didn't know how to deal with it. So when I talked to her, she kind of like, okay, so how did you feel about this, or how did you feel about this? I just like let open. I just said everything, and since that day, it's like, you know. But at first, I thought I was depressed. I went talk to her, and she was like, "You're not depressed." Like after that, later on, they do like a little follow up. It's like, you're not depressed. It's just so much was happening that it makes you feel like you can't. It's like you have no control, and sometimes you will feel powerless. You feel like you don't want to do anything, but it's not. It wasn't depression. It's just I was going through a lot. So that's why I'm saying, like, to me, when I think about depression, because I have like I've taken care of patients who have been depressed, and I've taken care of people who are actually not depressed, but they think they're depressed. So sometimes their symptoms might be the same, but they're not actually like getting that clinical what they call depression. I can't really give one specific answer.
That's understandable.
But it all has to do like with what everybody said. Everybody would experience it differently. But what everybody said, people will have those kind of same feelings.
Courtney, thank you for sharing, Bridget.
No, thank you.
You're welcome.
Oh, I went first.
Oh, you did. I'm sorry.
There's so much.
I thought you did. I'm
No,
sorry.
she
Okay,
went
so
fast.
I guess I'm the last one to go. So when somebody tells me that they're depressed, it's just a lack of energy. I mean, for me personally, it's been a lack of energy, because I do have my moments when I feel like I am depressed, and sometimes I don't really know what the cause of it is. Like as Eddie said, that it's usually something that's happening in life. But for me, it's like there's sometimes when I could be having I have my high highs, but I also have my low lows. So it's like I don't really know exactly where it's coming from. I just know, like, to get out of bed, to take a shower, like Courtney said, stuff like that. It seems like it's impossible at times. But like you said, talking to people, like, I'm telling you, if it wasn't for the people who are sitting on this couch right now, I don't know where I would be. Honestly, like, these are
That's
the
we're
first
sitting on the
people.
floor. Oh.
You see?
No,
Did you say the couch?
It's fine. If they don't want to count themselves, then that's fine.
No, I did.
This one. But yes, talk to someone, talk to a stranger, talk to your friends, talk to your sisters, talk to your mothers, talk to your aunts, uncles, whoever. Everybody needs that safe space where you can just go and talk to somebody and just release, because we're all going through something at the end of the day. Okay. But
And if you have, sorry, go ahead.
Yeah, but we all love you guys, and we all want you guys to be here. We all want to see your faces. So yes, what were you gonna say?
And if someone comes to talk to you, listen.
Yeah.
Listen to what they have to say. It's easy to say talk. The hardest thing to do is listen.
That's true. And I feel like listening is very easy, because like
it's not easy.
Listening is not
People,
easy.
sometimes people wanna.
Maybe
they wanna
that's just
say
in my
something.
character trait.
There's
Well,
a
that's a
there's
good
a
quality.
there's a
Yeah.
there's a saying there's a saying, you know, people hear but they don't listen.
Yeah.
So it's easy to hear. It's not easy to listen. Listen is the action, like the
You have to
act
be able
of
to understand.
attentively
understand
paying
what somebody's
attention. Yes,
saying.
what
Yeah.
someone is saying.
Okay.
That's usually it's a skill as well as an art. It's not that easy. When someone comes to you with, you know, especially something as serious as this depression, or you think might be something of that sort, it's important to, you know, listen and hear. They say, you know, you are given 2 ears and 1 mouth for a reason. So listen more, speak less.
What I can say is, it's nice to talk to people, but in my experience, it's find somebody who actually listens to you. You know, because people have their own problems. Like, why are you telling me about your own problems? So find somebody who listens to you.
Someone
who-
you trust.
Someone you trust. Someone who you know. If you go talk to, he or she will actually uplift you.
Yes.
You know, like, and if I go to my mom and say, "Hey, mom, I have this issue," she'll be like, "Eddie, let's have a sit, let's talk." But somebody else will be like, "You know what? I'm doing this right now. Let's talk later."
Yeah.
You know, so find somebody who you know will listen to you, bring you up if you're down, and just uplift you. You know, because not everyone wants to just listen to your problems and
Yeah.
help you out.
Also seek, like, one thing I would say, like, before like, after I went to that school counselor and I just sat down and talked to them, I valued how much it is important to, you know, when people used to say, "Oh, therapy, who goes to therapy, da 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 da," get that out of your mind.
Yes. Please do.
Do this for your own good. It is for you. Don't care about what other people are
Self-care.
going to think. It is for you. It is for your sanity. It is to help you. So I mean, some people might have a negative connotation towards therapy or whatever, but you just have to talk to somebody. People will say it's therapy. You're just talking to somebody, but it does it has tremendous effects. But yeah, depression is a very big topic, and today we're just talking about a little bit of how we
Yes,
feel.
just our own opinions.
Yeah.
and yes.
Next time we'll come back with, like, you know, signs and symptoms,
Yes.
and we'll have, like, okay, moments in life where, like, we can talk about moments in life where we thought we were depressed, and then it's like looking back at it, like, do you think you were actually depressed? And then hopefully next time one of our friend doctors will be here and they will get to share their expertise opinion on the topic. And
Expertise opinion.
it's the same thing, right? If you say expertise opinion, they'll get to share, you know, from a, like, medical professional point of view, you know what. I don't know, I think I'm saying the same thing, but like
You're
But
just
yes.
throwing words together. Now.
this is a very, very, very important topic, and people out there, like, do your research, find out some information, ask questions, you know, don't feel afraid. Like, if you feel some type of way and you don't know what it is, don't self-diagnose, because sometimes we have that tendency, you self-diagnose and then you just throw yourself deeper into a hole that you don't know what it is. So ask questions, seek medical help if you need it, seek a friend, just sit down and talk to them.
Laughter is the best medicine.
So
I'm telling you, with these guys, you'll have stitches all day.
Actually, look for us on Instagram. We'll help you there.
Yeah.
yes.
If you're
Because we
down,
have, like,
we'll help you
people
out.
in different fields of, like, life, and someone can sit down and talk to you guys. So next topic, and not next topic, next
episode.
next time we shall come back with more information on depression, some resources, and how to help a friend if they come to you and talk to you. Okay, I'm depressed, and, like, things to look out for, like, in your friends, because sometimes people have a good way of hiding it. Just look out for those things. So that's pretty much it.
Thank you guys for tuning in, and we'll see you next time. Bye.